in the clinical sign is well known for us. My topic is focused on the incidence and the spectra of the bacterium. And the incidence of endophthalmitis after cataract surgery. This is a review published in the Journal of Cataract Refraction Surgery, and it's about 580 article papers in the Chinese journal. The time is from 1995 to 2009, and the incidence is in average 0.06%. When the culture positive is in 60%, that is very similar like in India and Singapore. And fungi is about 12%. And if we look here, the bacterial culture is the Staphylococcus aureus ranks the number 1 in the gram-positive, and the Enterococcus ranks the number 2 in the gram-positive. But in the gram-negative, is the Pseudomonas ranks the first. This is the data from our hospital from 2006 to 2011. We have two groups. One group is the surgery in our hospital. There's 10,000 cases. And we got the endophthalmitis just 3. The prevalence was the 0.0275. And another arm is our doctor did the surgery, cataract surgeries in the trained hospital in many developing area in China. When the number of 12,000 cases, and also we just got 3 patients for endophthalmitis, and the prevalence is 0.024. So the surgery is made by our team is very low. But we have the endophthalmitis in the hospital. The main problem is after 23 or 25 gauge vitrectomy in our hospital. We have from 2006 to 2012 together 14 cases, and 5 cases is by the 23 and 25 gauge vitrectomy, and also 3 gauge is after bevacizumab injection. And for the endophthalmitis happened in the bevacizumab injection, that I think caused by the needles. We used the 26 gauge injection. Then we got the problem of the endophthalmitis. Since we changed the needle of 29 gauge, then no more endophthalmitis by Avastin. So the bacterial spectrum is 5 case Staphylococcus abdomitis and 3 case for Enterococcus. And for the 5 case in our hospital, the visual acuity, the prognosis of the visual acuity is not too bad. It's some case still 0.4, 0.5 visual acuity, but the prognosis for Enterococcus is very poor. Another cause for the endophthalmitis is trauma. The trauma is still big prevalence for endophthalmitis to 60 to 80 even %. And this is happening most in young patients, and the visual acuity is poor. So, and this I'd like to show you the data is from our hospital in the last year on the antibiotics sensitivity. We are happy the vancomycin and teicoplanin and adenosine those 100% sensitive for the bacteria. And this data was from 2003 from Guangzhou Zhongshan Eye Hospital. This is from the spectra. It's the similar like another data in China. Fungal 14%. Our data in average is 12%, and the number one is Staphylococcus epidermidis. But we look here, this is the data also from the Zhongshan Hospital in Guangzhou in 2000. The drug resistance is very high in some antibiotics, like the right color. If we compare the data from India, that was the data from WOC in Hong Kong in 2008, is also very similar for the bacterial spectrum. But in India, the fungus infections lower than in China, just 5%. We have is more than 12%. Compared to US, it's lower. Staphylococcus epidermidis is more mixed infections. Okay, by discussion, the ocular trauma ranks the first of the causes of endophthalmitis in China, and the successful rate of live examinations still the problem just to 66%. And the bacteria was still sensitive to cefaclor, but showed resistance to traditional general used antibiotics, including ciprofloxacin, tobramycin, and others. Yeah. Thank you.